Who knows what ICD is? ICD. We're right now working under ICD-10 with Medicare. Okay? ICD-10 was approved in 1994. All of Europe was in it. That's when everybody used to say you have to wait in lines, you can't get in to see the doctor, all that kind of stuff. We didn't get into it until Obamacare. And then we got into ICD-10. Okay? Does everybody understand? This was the computerization of healthcare. ICD stands for the International Cause of Death. And it was started in the late 1800s so that countries shared medical information. So it was a wonderful, wonderful thing. What it became was a AI computer matrix. Does everybody understand those words? Everybody understand what a matrix is? A matrix is calculations of numeric information that's put in on all of us. Does everybody understand that? That's why I told you guys at different lectures, if you want to get more information about your matrix, ask your physician at the end of your appointment to give you a printout of your matrix. And I'm going to warn you now, the last thing it says is prognosis. So they have to put a prognosis on there. And that scares a lot of patients. So that's the only reason I'm telling you, watch out for that last line. But the whole point is to understand, I was in England. I spent time in England in the 80s. And they were under this since 1994. Most European countries. This was a managed care network computerization. And it was the first time I heard, I'm going to scribble because I don't know how to spell. Okay, it's the first time I heard and this was when internet was like a baby. You know, but everybody's worried about AI. AI is like the internet. Can we all go back and remember pre-internet? How you had to go to a store, you know what I mean? Like you did your banking at the bank. Everybody did everything the way we wanted to do it from how we learned. The internet changed all that. And that change led to malls, strip malls now are now medical centers. You know, most of them can't keep the people there. You know, so it's all changed to computerization. What AI does is lets all the information, imagine a strainer, okay? And so the strainer has all those holes. All those holes are ports, that's what they call it, okay? So port or portal. So imagine that strainer has, each one of those holes has 1 million bits of information, 1 million. And so what AI does with the calculus and the mathematics is all that information they've had for years. I heard 1969. So they've had the data, the calculations, and the ability. And what's happened now is it's going to come live. When it comes live, there'll be so much information. Just you thinking will enable all these things to happen because it knows what we're thinking, okay? Why did I bring all this up? Because the ICD codes are now changing to ICD 11. Since Obama, we've been working under ICD, no, what's it called? Affordable Care Act. Affordable Care Act. I don't want to blame anybody. You know, Republicans and Democrats all did the same thing when it came to our health care, so there's no one party that's problematic, okay? So I don't want to call it, it's called the Affordable Care Act. And this started ICD-10 in America. Well, what did that change? Who in here has, well, you don't have to raise your hand, but what happens in the good days were all through the 90s, I practiced in the 80s, I practiced in the 2000s, and until this all hit, which I believe it was 2010, I would scribble like I just did because I couldn't write the word, but there would be enough on there to know the information. The pharmacist would fill the prescription and the lab office would do the test, okay? What this changed is, now that's looking at data on me. So whenever a patient of mine goes in to get a test and they say they can't read this and they have to call my office, and especially from COVID when I didn't have people to answer the call, and then I would get the message and I would think like, it's a lab, what are you calling me for? And then they wanted the ICD-10 code. I don't know what the I don't know any of the ICD codes at all. So you can still practice medicine with ICD codes. Everybody follow, I want to give you this perspective because you need this to understand what this talk's all about today. Has everybody got it? All right, so we'll put that over here, ICD. Now I need the other pen, we're getting into the good stuff. How we got into this, I just left for Jim, and hopefully he can get it all taken care of. I had a patient who, she's 82, and she wants to get a job. And I had all these forms that I had to go through with her. And I had never seen this one, ever. And what it is, I have to read it to you, because I never heard of it. I don't have it memorized. Not memorized, but I don't think about it in a way that obviously these people do. And it's a stress test, that's what they're calling it. They ask you 18 questions, and with the 18 questions, your answer goes into your matrix. And they're asking you questions about your beliefs, they're asking you questions about how you feel about certain things. And as I was reading it, I thought, well, what does this have to do with getting a job? And yet, what I realized was I had to fill it out. And it changed from PTSD, post-traumatic, spell it wrong, I'm sure, stress disorder. Couple of sides we have to take. DSM is the diagnostic tool for psychiatric disorders, okay? When you don't have a definitive chemical, physiological response, action with response to a disease, you don't call it a disease. You call it a syndrome. Well, what happens in psych, they call it a disorder. Okay, and the reason I bring that up is in my first life, starting out in medicine, with Joanne Betts, my nurse practitioner many years, we worked together for 5 years and I did occupational medicine. So I've seen it all. You know, when you have someone in occupational medicine working for a company, they want disability all the time. And so there's different things that they have to qualify for. And it's remarkable to me how the questions set up the answers. But it is what it is. I'm just bringing it up because I saw that form on an 82-year-old that was trying to get a job. And hopefully I get it printed for you today so everybody can see it. So what happens is post-traumatic stress disorder is a mental health disorder caused by involvement in a severely, spelling wrong again, stressful environment. I've been asked about PTSD a few times. I used to run with an ambulance, and when the plane went down, you never forget that. I can bring it up right now in my head. So stress is stress. Gruesome situations are gruesome situations. Things that happen from molestation all the way through to physical abuse in marriages. Bosses can be disrespectful. All the things that you can imagine play into mental health. Getting better at this. Not really. Okay, this is the frontal part of the brain. This is the occipital part of the brain, parietal, occipital back here. And then this is the temporal lobe. We have two of them, right and left. They talk about repressing thoughts. And I think I've talked to everybody before about, I trained in Baltimore. Long story short, I was on my way for a weekend, and the head of the psychiatry department made me stay because they were having a workshop, and they made me go through psychotherapy 3 times over the weekend. And I have to say, hindsight, it was the best thing that ever happened to me, because you realize that your brain's capacities we have no idea of. In our minds, every single thing that happened to us is there. It's stored. Pulling it up, that's the expertise of the psychotherapist. And I even find if you have a good hypnotist, they can get in there. But the bottom line is recognizing that mental health works by genetics. I'm scribbling again when I can't write. You know what I'm saying. So genetics, environment, and then what they usually call them are memories. One of my worst memories that I had when I was down in Grenada, the garbage trucks would go from community to community. And a lot of the young kids would try to jump on the garbage trucks to save from having to walk, say, a mile. And the one child fell off, cracked his head open. You know, there's nothing you can do down there because they don't have any x-ray or labs or those services. And it was just horrific because what they basically did was covered them up until the next garbage truck came. And you have that in your mind that you can pull up at any time. Those are things that we all see. Those are things that happen. And what happens to your memory and what happens to your mind is a function of, when I say genetics, we all have chromosomes. We all have DNA and RNA. And we talked about the brain, the capacities of the brain, the fact that the brain remembers every single thing that ever happened to you. And we have the temporal lobe, I'm just going to put T, and frontal lobe has a lot to do with behavior. So what I find is the genetics is big, but environment. I learned a lesson when I was in Baltimore. I was at Hopkins, and long story short, a kid came in and you could see the iron burn on his arm. And I read the chart and he had been in with broken bones. It was obviously he was being abused. And so I called the attending who said I could send him to the, it was like a health center for children, and ultimately then he would go to whatever the system allows, but you end up usually in an orphanage, okay? Long story short, I asked the secretary for the paperwork. And as I was filling it out, she asked if she could see me. And I said, sure. So we walked back into the kitchen. And she said, Dr. Coppola, I know what you're thinking, and I know I've seen this child here before, but please understand, if you put him in this system, he's gonna be sodomized tonight. please get the mother help and let us keep him in the hospital till I can find an aunt or a cousin or someone along those lines to take care of him. And I never forgot that, because the way the system is set up, everybody's stressors are different. And then how they play out, again, is related to your genetics and then the environment. Remember, I'm pushing this. I worked the Baltimore Street Clinic in Baltimore proudly. We did 150 deliveries in the month of July, 1980. And why I'm so happy about it is that people are people, and people take care of each other. And what I'm seeing with the post-traumatic stress disorder is now they're calling it complex post-traumatic stress disorder. And it all happens to go on how long you've had it. We all have had stress. We've all had too much stress. We all have ongoing stress. Does that mean no one has PTSD? No, not at all. But there's timelines related to it. We'll come back to this one because I want to go back over that. What happens with the PTSD, we all get the stress. We repress it. What brings it back? Memory. Who triggers the memory? It depends on the situation. But it can be triggered. So what happens? First one is intrusive thoughts. What does that mean? Now you can't get rid of it. I had situations in my life where things happen and then you find out what you thought was occurring wasn't occurring. And it gets in your mind, you repress it, but it's still in there. And so what happens is your focus now on trying to suppress it is taking up energy. Does everybody understand the concept? And that energy that it's taken up, don't forget, everything works perfectly within the body. Okay? So this is the spinal cord, this is the temporal lobe, this is the parietal lobe, and whatever genetics coupled with exposure, environment, leads to that stress. We repress it, it stays away, something brings back the memory, and now greater than 6 to 12 months is the time frame. If that lasts that long, that puts you in a post-traumatic stress disorder. And now what they're talking about, they're adding complex to it. So now it's CPTSD. And the things that they're putting in come from what, we'll get it. Karen's not here, Jim will help us get it, but everybody please look at it. And don't fill, when I say don't fill one out, I don't want to suggest anything negative about medicine, but I don't like ICD-11 because again, what it's going to do is that's the preparation for AI. And so all the data and information in the matrix that we all have is going to now be at the fingertips, coupled now with, like I said, remember the internet, what we talked about, how, slow as it was when we first started, and then the faster speeds, and then now you can talk to that one that talks to you while you're in your house, and you can have conversations and all those different things. That's just one of the portals. There's thousands of portals. And so all that information will become amazingly available just at the click of your fingers. And that's what I feel the ICD-11 is going to do. And why I said this, remember, I had a patient looking for a job, and she had to fill out the form, 18 questions, and they do no, occasionally, often, never, or something along those lines. And so the questions that they ask you, you answer these, and then there's a score, that's a number. And then that number says whether or not you're at risk for the complications of PTSD. All right, does everybody understand that? I had to make sure we got that part down, guys. All right, now, Presentation of PTSD. The biggest one is patient's different. What does that mean? Reclusive. So prior to, if they were like a socialite, that all changes. Excuse me. They quit caring. What does that mean? I've heard what they say. Why should I care? They died anyhow. Okay, so you get a negativism that hits, and when it hits, it's hard to break. Does everybody understand that concept? So you'll see a difference. The reclusiveness is a big one. The quit of caring is another big one. Unkempt. So man, maybe not shave and always did shave. This is on purpose. I'm playing Santa Claus at Christmas. Okay? You also find that they don't bathe, and their dress that used to be, let's say, coordinated is uncoordinated. Okay? And again, guys, I think that if you know somebody that's had a bad experience, or if you yourself has had a bad experience, then you're well aware of all the things that go with trying to get it out of your mind. And sometimes it's very difficult to get it out of your mind. And so that becomes a struggle. And that's the part that we want to talk about. And again, from my end of it, what I see most is behavior changes. Temporal lobe. You can see rage where you never saw the rage before, or you can see bursts of sobbing. And then behavior. Alcohol, drugs. And again, this was, the people never even did this before. This becomes something that they get so upset that they can't get it out of their mind, so they try so many different ways to get it out of their mind, and then it changes them. And so someone that was used to, say, Mary going to bingo twice a month at the church, doesn't see her, and maybe 6 months later stops by, and Mary takes her head off, yelling and screaming at her, which she's never done before. So it's behavioral change of someone that knows the person, recognizes it's different. And once again, the unkempt, like not shaving, not combing your hair, all the different things that the person usually did now doesn't do. Those are the ways in which you see there's a change, okay? Now, what do we do about it? You see a change. Patient doesn't want to talk. Why is that? They don't want to talk because it brings up the memory. I'll put it again for memory. I didn't know this. Does everybody know you could dial 988 and get help with any thoughts that are negative? Doesn't always have to be suicide. It used to be just standard suicide line, but 988, if this is your PTSD is now getting the better of you, you've changed, you're a different person, you don't like the way you feel, if you're having negative thoughts, 988 nationwide. I didn't know that. I thought that was interesting. All right, so the help you need to get is you have to be able to find I'm going to just say person. I don't want to make it all medical. To help you, and I'm putting forget here, and I'm going to put tough. So, do you go to a friend? Do you go to family? Counselor? Clergy? Support groups? Notice I said that one? That's the one I recommend. But again, I want to get more into the detail because, here, I'll give you an example. This is back in 2000 and I think it was 18 when it first started. And this was when nurses and even nurse practitioners were going into the homes of my patients depending upon their insurance. And they were having procedures done without my knowledge. Okay, so what happens is that your insurance company can have a contract with a group, and that group goes out to get information from you, okay? And they don't tell you that. And so it took time for me to make sure I had the patients understand, you don't have to let anybody in your house, ever. And again, what they tell you, the one that I thought was kind of unique, one guy got an umbrella and the other guy got a $25 gift certificate. And the one guy had back surgery, which he's had since I've known him, which was 28 years at the time. And the other patient had a total knee done. And both of those, to me, they're procedures that you need to talk about, period. You know, not necessarily myself and the doctor, but at least to the patient. You know, did they prepare you for what's going on? Did they tell you all about the day of surgery? Did they tell you about the day after surgery? Did they tell you how long it's going to take to get back on your feet? Those kinds of things. That's what has me concerned when I had to do this, you know, pre-employment physical and solve this form. So again, please pay attention to anything anybody's going to ask you to fill out, or if someone's coming to see you, you want to know exactly why they're coming to see you. Does everybody understand that? All right, so now, whenever you have the PTSD, which again, now it's complex PTSD, I prefer psychologists that do, there's different techniques, but I think the best one is psychoanalysis, which I've had done 3 times, and a hypnotist. I'm not gonna spell this right, guys. Hypnotist. Sounds good, right? Dr. Stiles I used to use. I'm not sure if he retired yet or not. They make a recording. Day one, they make a recording, and they give you that recording. And I've had patients that, like, they would lose a spouse and they would get anxious, and then all these memories would come back and they couldn't get it off their mind, and they would get palpitations. And I sent them everywhere, cardiology, neurologist, psychologist, and finally, I had a patient tell me that they went to a hypnotist and it worked. So I sent the patient to Dr. Stiles, they recorded everything, and when the guy would get anxious, they played the tape. You know, so there's definitely ways to enable you to assist your brain in repressing thoughts that don't take away energy and don't cause the symptoms that we talked about, okay? So I think that making sure you understand there's help out there with that 988, and this is who I would recommend. Does that mean you shouldn't see a psychiatrist, or you shouldn't see a neurologist, or you shouldn't see, no, I'm not saying don't do what you want to do, but these are what I found that help the most. I've never done CPTS. I haven't had that yet come up. All right, so now we have the patient. They sought help. In my practice, I'd say 70-30. 70% have benefited, 30% I'm not quite sure. I don't like medications long term. But sometimes the need, why? It's called the chemistry. If patients tell me, well, I read all the side effects and the pharmacist told me not to get it. Remember, guys, we do not like wake up one day or open up your chart and say, I think this patient needs XYZ medicine. It's all based on the symptomology of what the patient's experiencing, and then ultimately, if I have the expertise, I do it. If I don't, I get a consultant. And so The ones I told you, the hypnotist and the psychologist, are what I like. When you get the help, whatever it happens to be, I would still suggest support group. (1992), that seems like a long time ago. I started the first Alzheimer's support group at the Arden Courts at Manor Care North Hills. And the way it all happened was they had a room, it was called the support room. And it was a big circle, and everybody can go in there. You could talk to your loved one. And the one day I walked in, I saw a lot of, it was more men than women, by the way, meaning with the disease. And I saw a lot of the women just talking. And they were laughing, and they were enjoying each other's company. And so I was nebby. I went over and listened, and it was amazing. They were talking about symptoms that their spouses had. And that, you know, again, this was when it first came out, so we didn't know a lot about it. And so I thought, I told the, Rick was his name, Rick Borowski. I said, hey, you need to do a support group. And he asked if I'd run it, and I'd say, sure, I did it started. And it was awesome. It was just so amazing to see people talking about situations they were in because their loved one had the dementia, and that led to other people talking. And so again, I have not personally attended a PTSD group therapy session, but I would definitely recommend, if you know somebody or someone yourselves or whatever, that you feel that you have these thoughts, they become intrusive because they're affecting who you are, how you are, what you do, and how you do it, then I think it's a good idea to try it. Now, the part that for me was so concerning was the form, guys. And I have to, I'll blow it up on the phone to read you something. Depression scale, anxiety scale, mini mental. This is a wellness visit. Medications, past medical history, past surgical history, social history, and then there's a series of questions. I think there's, I want to say 18. That seems like a number they stick with. There's 18 questions. Remember what I told you is coming, ICD-11. This whole talks about ICD-11's coming, I'm not happy about it. And then I had a patient that I had to do this form for her to get a job at 82 years old. And I just thought that from my end of it, what I'm seeing that is being asked, I don't understand how that applies to someone applying a job. Because I'm still hiring people, because I just don't have the staff I need. And before I go in, all my girls warn me, you can't ask them this, you can't ask them that. Well, these forms are asking everything. And that's my concern of information that we provide. I don't want you not to, but you're allowed to say no comment. If they're doing a mini mental, you don't want to say I don't know. You know, so I would say that one might benefit you to see how you're performing. The depression one and the anxiety ones that are all part of the wellness right now, but these other ones are coming. And that's what I want to make sure that everybody understands, that you do not have to answer these. You know, this is something that is voluntary on your part as part of a wellness evaluation. The insurance company still pays for it, so it's not going to be a, you know, demerit on you that you didn't fill out all the paperwork, so therefore we're not paying for it. So I just want to make sure everybody's aware of that. Okay, so from my end of it, this is the information that I put in on a wellness visit. In ICD-10, after that, I would say has 144 characters. If there's anybody computer literate, if I'm using the wrong terminology, let me know. but that's what I call it. And by the way, this is ICD-10. ICD-9 had about 40. Now, does that mean ICD-9 did a bad thing? No. Remember what ICD stands for. International Cause of Death. Started in the 1800s so that countries could observe from other countries and realize what's going on and maybe help their population. That's how it was all started. And so now we've moved from the ICD-9 that with 40 characters, probably written in a notebook back then, you had a handle on the patient. What does that mean? This information gives me, ADLs have been around forever. What's that? Activities of daily living. So what are your activities of daily living? That's the part that the girls ask you. By the time I get you, I only have to ask you the ones that I put. But the bottom line is that they want to know, are you bathing, dressing? Are you cooking? Are you cleaning? Are you able to take your garbage out? Are you able to get into your shower? All these things. Now, is that intrusive? No, because I really think it was set up to help. I really do believe that the ADLs give the occupational or physical therapist the ability to assess you in the short period of time they get to know you. So you're walking in, they're taking your name, your insurance, all those kinds of things. And then they ask you that question to see, okay, this is where we're starting. And then they do a physical exam on you to recognize what they can help. So those things I'm fine with, but my concern, like I said, is we're moving into the ICD-11. This was the change from ICD-9 to ICD-10. And don't forget, the computer changed with internet. It's not a coincidence ICD-11 is coming with AI. Does everybody follow that? Am I a conspiracy theorist and believe that this is no good and stay away from it? No. I'm an independent physician. So I pay attention to what I'm watching. And what I'm watching is, I don't understand why 18 questions are being asked to my patient who never had any history of anything that I've taken, any hospital that she's gone to, that she had post-traumatic stress disorder. But there was a questionnaire related to it. And once again, some of the questions were, what's the word? It makes you think. Say, to me, like I said, I'm suppressing stuff from what I saw when I was riding on an ambulance. I mean, I've seen a lot of stuff. I've seen a decapitated person from a motor vehicle accident on the turnpike. I saw the remains of that airplane crash. It's in there. But I'm a physician. I see a lot of different things. And it doesn't stay with me and hasn't changed me too much, even though I haven't shaved. But overall, I think the part of it that I saw was, why is this being done? And then, when I started looking everything up on this ICD-11, it just caught my attention that, wait a minute, ICD-9, we never did wellness evaluations. We knew the patient, and we talked to the patient. Now with ICD-10, there's wellness evaluation, which has a lot of questions. And we ask a lot of questions. And I still think the questions are pertinent for your safety. Example, do you have throw rugs or extension cords? Because that's the most common way in which you trip and fall. So that's a good question. Do you wear sunscreen? That's a good question. You know, do you drink alcohol? That's an okay question, but you don't have to get into, well, how many drinks do you have a week? Okay, and yet at the same time, that's valuable information given medically for a wellness evaluation. So all those things over time you pay attention to. Does everybody understand the concept? The forms that are out that are coinciding with ICD-11, I'm just giving you the snapshot. And then we'll take a break in July, and then in August, I'm gonna be computerized. And I'll have the data, like when I'm telling you this stuff now the stuff I read, I can throw into the computer. I hate it. I still love my cell phone and flip top, but I recognize I have to go along with the flow. All right, guys, so now this is 40 to 144 with ICD-9 to ICD-10. ICD-11, there's gonna be with AI, I mean, I'm venturing to say 1,000. And people will think like, wait, how can you go from 144 to 1,000? What I've read is just phenomenal, guys. It's just like the computer, internet. Think of America pre-internet. Or go back to the great days. I tell my kids, TV went off at midnight and stores weren't open on Sunday. What? What did you do? You had fun on Sunday with family, without the TV. It was just one of those things, it's a change. So this change is upon us. The matrix is growing. The information they're gathering, they're getting from you. And I'm telling you to be honest. I'm not telling you that you say anything disrespectful or dishonest to anybody ever. Just pay attention to the questions that you're answering. And again, especially if they get you in the hospital, just say, can we do this tomorrow? And then make sure that someone's with you, that knows you. If you don't have that, then you tell them that you want to wait till your doctor comes in and you'll fill out the form. Does everybody understand the concept? All right, so now, PTSD treatment, medications. We used to call them tranquilizers. So I'm going to say twank, put a Q. And what was the most prescribed medication in the 60s? They used to call that vitamin V when I was a resident. Ladies acting up in room 10, can we give vitamin V? And that was the intern asking me if they'd give some Valium so they can go to sleep for the night and the patient relaxes and doesn't stay awake all night. But the point is, how does that work? When we talked about the brain, temporal lobe, the changes that happen chemically. There's a chemical called GABA-butyric acid, and we've all heard of serotonin. There's norepinephrine, epinephrine, and I'll put GABA. And I'm not denying PTSD at all, guys. Don't think that at all. That's not at all what to talk about. It's real. It happens. And remember what I said, it's a mental health disorder. What does that mean? That you can't keep your day-to-day mental health where and how you want it because of these intrusive thoughts from what you witnessed or what you went through or what occurred with you. And it's amazing. I like fires, car accidents. I had a patient, he was 90 years old. I shouldn't laugh, it's not funny. His daughter, who lives in Syracuse, was having a Christmas party. So he's driving to Syracuse on 79, spins, rolls down a hill, and he's upside down in his SUV, and the water's coming up. And I said, his name's Harold. I said, Harold, what were you thinking? He said, I was thinking, should I do the seatbelt or just hope I get help? And I said, so what'd you do? He said, I prayed. I said, what happened? He said, there was a truck behind me with a winch, came down and pulled him out. You know what he was so upset about? His children wouldn't let him drive anymore. That's what upset him. And it was like, Harold, don't you realize, like, you could have died? But I didn't. And I've had other friends have accidents. Well, then don't drive in the snow. Tell them that. So I got him to be able to drive locally. And then he had an accident. And the family got all upset with me. He didn't hurt anybody. He hit his garbage cans as he was pulling out. But again, guys, the medications for PTSD all have to do with brain chemistry. Do you need it? Yes. If you're suffering from this mental health condition that has your mind on whatever you went through. Fires, big one. Car accidents. I had a patient that wrecked a PAT bus. She was Port Authority. She was only there for, I think it was like 6 months in, and she wrecked the bus. And a car pulled out in front of her. And she had that bus lanes. She was like, it was like if someone tries to go across the train tracks while the red light's blinking. But it got her because she had to go to court and all those things. It just got to her. And so she was off for probably 5 or 6 years. She was just in my office last week. She retired, 30 years she put in. So she got back through help, and she was on medication. I also had her go, she saw a psychotherapist, and the way they get into your mind is phenomenal. It's things that they'll say word association, or there's different testing that they'll do, and with the questions that they ask you, your answer guides them to the part of your brain that they want to get into. And they'll have you recalling the accident vividly and telling descriptively exactly what your mind recalls, how it goes into slow motion while it happens. It's pretty remarkable how non-medical treatment can work. Uh-oh. Oh, that's only my bookie. Sorry about that, guys. Oop, I thought I shut it off. I think I have to hit this other button. See how they're making me use this phone? There you go. All right, so now what I want to do is make sure that we all see a couple of these questions. The testing for thoughts you're having. Before I was rudely interrupted, that's why I was bringing up with the psychoanalysis. I'm just scribbling. With the psychoanalysis, they do word association. They'll have you look at ink blots. And the whole idea is to get you thinking of what they're asking you, to pull your mind away from what's in there at that moment. And then as they get you over here, they like go back to what they know of your history. And they try to bring certain things out, and they do it in such a way that you're so comfortable with the process of getting to that point that they're asking you questions that you readily just talk. And what I found, like I said, I did it 3 times. If you've ever taken a test, and after the test you just feel like you don't even want to think, you know, your mind is numb because of all that you just went through thinking that way. That's how I felt after I did the test. But it was amazing how they had me remembering when I was 18 months old, you know, which again brings you back to anything that you've seen in your lifetime. It's up there, you know, it's stored someplace. And that's why when we repress things, whatever you have to repress, that takes energy, and that affects the chemistry in the brain. Everybody understands that. That's very, very important to recognize. All right, so if you do have to get onto medication, I recommend a psychologist with experience and that could mean it could be a new person. It could be a 25-year-old. But if they trained with somebody that was well versed in these techniques, that's fine. Okay, so you want to make sure. Why I like the psychologist is they can't prescribe medication. Why is that important? Because they have to talk to me if they want medication for the patient. The PCP writes the prescription. So you send the patient to see the psychologist. The psychologist spends time with the patient. They do their services, whatever they happen to be. I usually recommend the psychoanalysis. And then afterwards, they send me a report. And they may say something like, I want to get her in once a week, see if we can continue, work, like progress on whatever they happen to have hit on. Or they may say, what I want to do is start X, Y, and Z medication at a very low dose. If you agree with my assessment, could you call that into the pharmacy, and then I will see her weekly and get back to you. That's why I like the psychologist. It's not the psychiatrists are bad, but what happens is the psychiatrists, they're like the chemists. They know all the chemistry of the brain, and so what they feel is best is to chemically manipulate some of the thoughts and ideas to settle the patient down so that they can function better. I have, in my practice, I haven't found that the chemicals do better than the psychologist talking to me, expressing what happens, and then you get that feedback every week. Usually in a letter, but sometimes in a phone call. Is everybody with me? Sorry about that, guys. So now what I see is the most important is, I'm just gonna put RX for treatment. You have to look for that intrusive changes. You have to observe those, and they say at least every 2 weeks. And remember what we talked about. This person that was quiet, now all of a sudden is ranting. Let's say they never drank, now they're drinking, or drugs, or smoking. That's a big thing. Sometimes people never smoke, and all of a sudden now they're smoking cigarettes. So all these things that you see, we call that intrusive changes. Once the treatment starts, that all has to be observed. It has to be observed regularly. That's one of the things about mental health disorders. Like, this is a constant. The patient has this constantly. This isn't something that just goes back and forth. If it gets to that point that it's post-traumatic stress disorder, that means that it's beyond 6 months up to 12 months, and they can't get this out of their mind. It's become intrusive in their mannerisms, from shaving, dressing, bathing, all the different things they do. Even if they weren't a socialite before, they would at least go to different functions, and now they're not going to them, or they're angry and lashing out, and that they never did that before. So you want to make sure whatever treatment pathway we go through, every 2 weeks, that's paid attention to. All right, does everybody follow me? All right, wait, I want to do the questions. Just a couple of the ones that got my attention that I thought it would be appropriate. I gotta find it again. Appropriate to go over, just so that from my end of it, you see if you agree with me. Okay? Let's see. Sorry about that. I wanted to get it all up on the computer, so this would be the first time I had it, and I'd be able to share it all with you. All right. And of course, it comes in 2, and I don't use this well. It's a different one. Sorry, guys. See, that's why I don't do these phones, because I don't do them well. All right. How do I get out of that? I don't know how to get out of it. I won't do it. What I'll do is, hopefully, if Jim, were you able to copy that? Part of it, okay. He'll give you the part of it so you guys can see the questions. What I found with it was intrusive questioning, that they were looking for a response. Oh, good. Can I read those? Perfect. Good job. Excellent. Thank you. Good. Thank you, thank you, thank you. Oh, now I need cheaters. Did I bring cheaters? I think I have my cheaters. Yes. All right, guys. Thank Jim, because he pulled it off. Thank you, Jim. Let me see the one. You guys are going to have a hard time reading them, too. You better hope your cheaters are working. All right. Well, let's just say they're guided questions. I don't want to put comments in, because he didn't. You guys will be able to read them. I find that if a patient that I'm seeing has a problem, and they haven't said anything about that problem to 3 people that see him before I do, and then if I go through the questionnaire, it prompts them to go down that pathway. And that's what I saw in these questions. So you guys can read them for yourself and see what you think. That's what I did to talk about, because when my 82-year-old, which by the way, she'll find out Friday's tomorrow, right? She'll find out tomorrow she got the job. And from my end of it, I just didn't see any of those mattered. And I was shocked, but that's when I found out that the ICD-11 has more forms like this that are coming out that you'll be, for the wellness, I guess. Is it free? I don't know if it's free. Whatever, they tell us that the patients can come in and they can do these things. And again, I thought it's a great idea. We've been doing it for years. But when I saw that related to a pre-employment evaluation, it got my attention, okay? All right, guys, the only other thing I want to leave you with the mental health. What should you think of when you think of mental health? Your mind. I had a unique experience happen. What you want to think about with mental health all the time is your mind. What is your mind and how does it function? Your mind is a constellation of billions, that's a B, billions of cells, and neurologic tissues and organs that keep your body functioning at the highest capacity. And what do we do with it? Everything that goes past your lips has an effect on your mind. Everything that you see and hear has an effect on your mind. And there's places within your mind that can store all that information and never, ever, ever cause you any negative response to anything that you saw, did, or thought. What happens is, you ever heard that adage of your mind plays tricks on you? What'll happen is that you put it in whatever space you want to put it in, and then all of a sudden, it'll come up. And when I say it'll come up, how does it come up? For me, my grandmother was like a saint. Why? Because she married my grandfather. And what I used to love is, over the years, I quoted her so much. So she's part of my mind because that's who I grew up with. That was my environment. And so what I find myself a lot of times is when call it an issue is coming up, I won't even have to think about her. I'm already reviewing in my mind the things she taught me. And like they come up all the time now, even with my children. And that's why I say these things and go over these things, because our mind is special and it's yours. Nobody owns it but you. And I'm not saying don't answer questions. I'm not saying don't do wellness evaluations. I'm not saying don't follow what your insurance company tells you to do. But be mindful of what the question says and look at all the choices. And don't fudge anything, don't lie about it. I'm not telling anybody to do anything negative. It just caught my attention, guys. And again, it's like I said, the capacities are so huge in our minds that what I find is, that's why I'm telling you about the hypnotist and the psychologist. If you yourself or anybody you know has a problem with the PTSD, or now what's coming out, CPTSD, and if there is, please tell them to see the psychologist or the hypnotist, because that's where they will find out. These people get into your mind, literally. That's their function. They are able to kind of get in there and get a sense through all the parts of your mind. They question you and they get information from the stored information you have in your memory. And that's why I think it is so fundamentally beneficial. Like I said, I had to do it, because I was a medical student. They did all kinds of stuff to medical students, because you were like the guinea pig. And that weekend I had to go. And as it turned out, it was the best thing that ever happened. So please understand that your mind is special. It's been many, many, many years it's developed, and there's billions of cells up there put in places, like we mentioned, the frontal lobe, the parietal lobe, the occipital lobe, the cerebellum, the temporal lobes, and then inside there's parts of the brain that function, and I used to call it like the train station. That's how they used to work. Central train station sent you everywhere. That's what the thalamus does. And so the way the brain works, the chemicals constantly. Remember how we look at something and you bring your finger in, that's 375 milliseconds. Think of how fast, as we're all sitting here, all those chemicals are functioning. So any mental health disorder that takes that off track, please pay attention. And if it's your personal self, talk to somebody. And again, guys, it doesn't have to be a doctor, it doesn't have to be a psychologist, just talk to somebody. Because most times just venting what's going on helps the situation internally. And that's what you want to be able to do, is relax and calm down. And again, I'm not saying don't take medicine. So if there's somebody you know, or yourself, or whomever that has a problem with the PTSD or recurrent thoughts that bring you back to things you don't want to think about, remember, there's always help. Don't forget that 988. Like we all think of 911, 988. Get you somebody you can talk to immediately, and you tell them, you know, this doctor told me if I ever have these thoughts to call. That's all you have to do, and they'll help out. Okay, guys? I wasn't too late today. Any questions? Good, thanks for having me. Sorry next month I'm off, but my daughter's pregnant, and I forget what's going on, some kind of party. And I'm going, my grandson gets baptized this weekend. So I'm looking forward to that one. So it's fun now, man. All these kids are gonna start having children. This is when it gets fun for me. Good deal, guys. Thanks for having me. It's nice in here. I wish I could stay in here all day. It's hot outside, man.